All right. I think that we're starting right now. Doing a quick audio check to make sure that people can hear me. Hello, hello. This is David Poon. Typing in the chat. Hello, can you hear me? So, waiting for the chat to start, waiting for someone to hear. Looks like the audio is working okay, confirming audio works. Hello, everyone. My name is Dr. David Edward Poon, founder of the Face of Advocacy. This is our update for December the 2nd, 2021. We're going to be covering three topics today. Number one, the changes to the travel restrictions due to the Omicron variant. Number two, talking about vaccine hesitant versus unvaccinated. And then number three, a little bit about myself. So, number one, lots of new changes and things that we need to be cognizant of. First off, nothing is changing at the US land border. The rules have not been touched today with Biden's new announcement. So you can still drive in if you're fully vaccinated into the US and come back. There are exemptions for a short duration, so you can get tested in Canada. Uh, Sorry, you can leave and come back within 72 hours without any testing whatsoever um, to come back into Canada. However, if you're staying in the US for longer than 72 hours, you'll need to get a test to come back into the country. So that's one change. The second change in regards to the US, though, is if you're flying into the US, you will require a COVID test 24 hours before your flight. So within 24 hours, you need to be tested before you can fly into the US. That number used to be 72 hours. Right now, it's 24 hours. So please be cognizant of that as you move forward with your holiday plans if you have any. With the Omicron variant, there are going to be a lot of new changes. Um, so if you are from one of the countries where the variant of concern are more present, so there are 10 countries in total: Botswana, Egypt, Eswatini, Lesotho, Malawi, Mozambique, Nambia, Nigeria, South Africa, and Zimbabwe. If coming from those countries, there are going to be a lot of changes. Oh, Julie, we're going to US tomorrow. Well, hopefully you got your test, so you'll be able to make it. If you have loved ones in those other countries, there are a few things for you to know. The reason why it's important for us to talk about right now is this list could expand. I have no idea if it's going to expand, but if Omicron hotspots increase to other countries, one can speculate that these travel restrictions might as well. It's important to understand the details. So currently, there are no exemptions for foreign nationals to come in from those 10 countries if they have been in those 10 countries for the past 14 days. So that means our extended family exemptions, our immediate family exemptions, and compassionate exemptions have not worked. This is very upsetting, and you have to join us on Advocacy Thursday, so that's today, and send in your letter. We're hoping to see a little bit more engagement. If you're able to, please find us and please send this letter. If you are allowed to come back from those 10 countries, you would only be able to do so after you've left those 10 countries for at least 14 days. If you are a Canadian citizen, a permanent resident, or someone with status under the Indian Act, you can come back from those 10 countries into Canada. There are no direct flights, but if you've been there within the past 10 days, you'd be able to actually come into Canada. Once you're here, this is where things get interesting. So if you have just arrived from one of those 10 countries in the past 14 days into Canada, you not only have your pre-departure test, but you also have your arrival test, and then you have to go into quarantine for 14 days. No exemptions to that. So you'll have the arrival test and your day 8 test. Where do you have to quarantine is a question that's currently being sorted out. But according to the orders in council, it is either at a federally mandated quarantine facility or at a place that's considered suitable. So far, I have not heard any reports of someone going to a federally regulated quarantine facility, so it may just be home quarantine. That's critical to note, though, that there is the possibility of a federally required quarantine facility for those coming back. Um, if you're flying into Canada from any other country in the world other than those 10 countries and the United States, you would need to do your pre-departure test to arrive in Canada, which is within 72 hours. And then once you get here, you will be doing a on-arrival test. We're still figuring out if that's Switch Health or not. The on-arrival test, you have to quarantine until those results come back. So far, we have not heard of anyone having to go to a federally designated quarantine facility while waiting. They just have to go back to their suitable place of quarantine, which is home, and then wait for that result. We're still finding out a lot more information about that. If you are flying in from the United States, you still do your pre-departure or your pre-arrival to Canada 72-hour test. You land here, but there's no on arrival testing, and that is only for the United States. So, once again, to recap, driving into the US, nothing has changed. Flying into the US, you need a test within 24 hours. Flying into Canada from one of the 10 countries, you have a 2-week quarantine. Flying into Canada from any other country other than those 10 countries and the US, you need a post arrival test. And if you're flying in from the United States, there's no post arrival test, just your pre departure or pre arrival to Canada test. It's a lot. This is an evolving situation. We'll monitor it closely. If you're upset with it, if you have issues, join us in our letter writing campaign and write to your member of parliament. Everyone is starting to get their staff in order. They'll be responding to messages hopefully soon. But these are major concerns. And what really bothers me about this, the new order in council from the 10 countries, is that they did not preserve any immediate, extended, or compassion exemptions. That's what we fought for over the past 18 months. That's what we won, and it's not there. I'm still trying to find explicit confirmation. So far, the IRCC has told me that there are no exemptions to the current order in council from the 10 countries. However, it still needs some confirmation from health, which has not gone back to me yet. So those are the Omicron changes. I'm going to do a quick look at the chat here. Test book tomorrow morning. Have the pre-test rules to travel into Canada changed as well? The pre-test rules requiring you to have a PCR within 72 hours of flying into Canada is still in effect. Um, Going to Canada, you need to be fully vaccinated. Yep, so thank you, Kara, for reviewing that information. Um, Thank you for doing these weekly updates. It's much appreciated. Thank you for being here. I'm not too sure uh, what interval we need, but we did one 2 days ago. If you don't mind watching that, we're doing one today, and we'll continue to do so as needed. So nothing else in the chat. Okay, so on Tuesday, I discussed the concept of vaccine hesitancy and why some people are not vaccinated. On Wednesday, the Faces of Advocacy made a statement about how the extended family exemptions, according to the government, are ending in January, and we want to preserve them. What motivates us is that there are many family members of Canadians who live in vaccine poor nations. They can't even get the vaccine. The extended family exemption should exist for that. And I realize that there are some people who are concerned about that position. And so I want to have a good dialogue about that. So I want to clarify a big difference that I feel have been conflated in terminology. There are those who are vaccine hesitant, and then there are those who are anti vax. And I ask you, all Faces of Advocacy members, to not conflate the two. People who are vaccine hesitant, as I talked about on Tuesday, sometimes they need more information. Sometimes they're just worried about their health, even though it's not a specified contraindication. Some people have been racialized. They believe the white man is testing a vaccine on them. Some people have been hurt if they're part of particular religious or ethnic groups that have been subject to government interventions that they don't trust. There are a number of reasons that someone may not be vaccinated. And I ask you to please approach people with compassion if they are concerned and if they are worried. The second group, who we'll broadly call anti-vaxxers. These are people who do not believe that the vaccines work, who believe that the COVID is a conspiracy, who believe that I'm being paid off by the government to tell you these things. I have tried to keep a good dialogue. I do not think there is a good discussion that we can have. I do not think that we have a mutual understanding of one another. And worse, I feel that there is a concerted effort to not be understanding sometimes amongst people who believe that vaccines do not work, that COVID is a fake pandemic, and that David Poon gets paid by big government to give vaccines. Uh, if that is your position, there are other places for you to go, but we have nothing to talk about. For those who are vaccine hesitant, I know a lot of you helped with the advocacy movement, and I want you to know that uh, you are not a group that is unwelcome to talk in our forums. I I understand that there's a lot that needs to be done. I understand there are fears. I really do understand that. Um, because our position is that vaccines work, um, and because we also realize that there is a poverty of vaccines in other countries, we believe that there is a place for our extended family exemptions uh, currently. And we believe there will be a need for that post January 2022 when the government of Canada will take those away. We want it to stay, and we're motivated by those in vaccine impoverished nations. If we are successful in keeping the extended family exemption and it doesn't change, it'll most likely still apply to those people who need it right now from countries where there is an abundance of vaccine. I can only strongly hope that if you are in a place where vaccines are available to you, please read up on it, talk to your trusted family physician, talk to trusted sources, and hopefully you'll be willing to get something that offers you protection. This is not coercion. If you have questions, you'll have physicians who you trust talk to you about it. On the group, we have a policy not to debate vaccine science. So if you see people arguing vaccine science, please flag it. If there are people discussing their worries and maybe reactions or other concerns, it's more of a gray area, but we can talk about it. If your mental health is suffering because you're worried, if you're worried about separation, even though you're vaccine hesitant, you still have a place with us because I understand how concerning it can be. I myself believe very strongly the vaccine works. The members of the Face of Advocacy on our team believe that it works. But just because you may have a different opinion and just because you may be hesitant, it doesn't mean that you're not welcome to discuss. But please be polite. Please do not debate the science. And if the exemptions that we're advocating for in vaccine impoverished nations end up helping those who are in not vaccine impoverished nations, it just means that the exemption has stayed the same. I say this directly to people who believe that Faces of Advocacy is not being helpful to them. I can only say, as of today, the only way a non-vaccinated person is able to come into Canada is from the exemptions that we fought for. So as far as I'm concerned, we have had a great success in helping a number of people. Now that vaccines are plentiful in a lot of countries, there is little reason not to get vaccinated, but we'll still help those who are unvaccinated in from areas where the vaccine is not available. We're still trying to help those people too. It is very upsetting to see many people benefit from our work and not take the time to truly understand the nuances of how our science-based approach has worked. There are two people banned from Faces of Advocacy yesterday. One of them has returned. The two people who have been banned, they were banned for insulting other people. The person who is banned and still banned insulted a person with a medical condition, which is grossly inappropriate. And that sort of thing will get you banned from the Faces of Advocacy, no question. The second person who is unbanned, I don't know if that person actually came back, but they insulted me. And while I don't like it, the reason why I think it's reasonable is because you have needed to trust me a lot over the past 18 months. I have never felt that I am a leader, nor do I expect you to follow anything I do. However, I do understand that everything we've done requires a tremendous amount of trust for me. So if someone is questioning who I am, questioning what I do, questioning my what kind of person I am, I actually understand it, and I think there is a place for that because you have every right to question the kind of person who you're seeing, who you're talking to, who you're trusting. So this will bring us to the final section of today, and that is who I am. Oh, let's take a look at the chats. Um, so, um, Aaron Avenant, who has been running our daily mental health threads. Thank you so much for keeping that up. That's been such a help for a lot of us. If you're feeling like you have no one to talk to, like if people don't understand you, many of us will. Please post under the daily threads. The daily care threads happen every single day. She's been an all-star with that. It's a safe place to talk, and I really believe it's helped a number of people. If you're feeling stressed, overwhelmed, just come and chat. We're happy to get to know you more. Um, okay, so so once again, the third section, you should get to know who I am because you're trusting me. So if there's criticism or concern about me, I don't, as far as I can tell, none of the mod team will ban you. I've asked them not to ban anyone. I've asked them not to remove those comments unless it's overtly racist and insulting. At which point, yeah, we'll be issuing some bounds. But questioning who I am, I think, is an appropriate thing because you put a lot of trust in me. So, my name is David Edward Uy Poon. Edward is my father's first name. Uy is my mother's maiden name. I am a Malaysian Chinese Canadian. My mother's Malaysian, my father's Chinese. I was born in Regina, Saskatchewan. Um, I did debates and improv in high school. I did my pre-med in Saskatoon. I did my medical school in Edmonton at the University of Alberta. My parents are both family physicians. I'm doing my residency here in Toronto. Residency is a specialization for a doctor. I have been a doctor since 2013. Some of you might remember that during the time of us getting our exemptions, I was studying for a big exam. By that point, I've already written multiple exams for different licenses, but at that point, I was writing my family medicine exam. Up until that point, I'd spent time doing other things with my life, trying to figure out what I wanted to do. And so I've been doing things like stand-up comedy. I did some counseling work for TV shows and for movies. Um, I've been trying to find different ways to use my medical training in different aspects. I doubled down, and thanks to the encouragement of my partner, I was able to complete family medicine. At the same time, we got our exemptions. So I've had a full license in Saskatchewan since about 2019, although I had a different type of license before that. And then I recently got my Ontario license. Following the family medicine residency, I did a master's of public health in Columbia University in New York. Not Columbia, the South American country, Columbia University in New York. It's the same school that Spider-Man went to. Um, there, I did increasing public health training to understand the scope. It coincidentally was the year of the pandemic, and it just helped me learn a few more things. I have since continued with an additional residency, so an additional specialization. So yes, I'm a fully licensed family physician. I have a master's of public health, and now I'm continuing continuing my training, doing extra specialty training in public health and preventive medicine at the University of Toronto. Nothing I do is speaking on behalf of UT, but I am a resident there. So while I have my independent license, I also have a license to learn extra things. The basic idea is at the end of this training, I could be a medical officer of health. So similar to Kieran Moore in Ontario or Bonnie Henry in BC. These are the people who would be making decisions in a pandemic. You have multiple local medical officers of health, depending on your city. And so I could be that. I don't know exactly what my career path will take, but that's where I am. Anytime I speak to you in the face of advocacy, I make sure to mention that while I am a doctor, I do not speak to you as a doctor. I speak to you as a person of the public. So I'm using publicly available information. I'm not using anything that I get in my training. I'm not using anything to say that I know better than someone else. I'm using only the information publicly available. And that's the same way that I talk to politicians as well. This is what the stats are. This is what you said that means. So some of you might wonder, are there other incentives for you to do this, David? And I can only say that the greatest incentive was to be with my partner. And for the majority of the time that we've running Faces of Advocacy, I've been with my partner. I was in Ireland with her. She was able to come to New York with me. She's with me right now, a meter away. That's the greatest incentive I have, and I've had that. Me doing this, any of the team doing this for Faces of Advocacy is not for any sort of monetary or gain. I ran in the federal election not to win. There's no way an independent could win. I did so to debate Bill Blair, the guy who harmed us. Um, I receive no monetary compensation. In fact, I take a pay cut for me doing this right now. I'm not seeing patients, and I'm not seeing patients not making money. And no, I don't make money for promoting vaccines or something like that. And no one has bribed me with any big government money. If anything, I've probably made a few enemies in the government from doing this. My priority is to work with all of you wonderful people, and enact safe, scientifically backed change to reunite families in Canada. And then after that, we're going to be fighting to revamp the CBSA and the IRCC. We're going to be focusing on other advocacy projects. We're going to be doing a lot of good. The COVID related family separations, I thought we were past. It looks like they're still going to have a few shadows with Omicron or whatever else might come. If you are able to help us, I beg of you, I see a lot of engagement when we're talking about anti-vaxxing. Well, how about some engagement with our Thursday letters? How about posting something about how we can help, getting to talk to your MPs? Let's get some stuff done. So that's one thing we can do. If you prefer to donate money, you can find us at buymeacoffee.com/faces of advocacy. It goes back into the team and the projects that we're doing. And no, it doesn't go to line David Poon's pockets. I'll answer some questions here until there are no more questions. Uh, Brian, are you the guy who was posting yesterday in the thread? Are you the same Brian? So Brian says it's a lot easier to get exemptions and get things done when you have a doctor as the face of the group and advocating based on science. I will agree with the latter part of your sentence. It's a lot easier to advocate based on science, but I will say all the successes have very little to do with the fact that I am around. I'd say you guys have been incredible. You've all written letters. You've all fought for us. We have a fantastic team. David Poon is not very important to this whole thing. Um, Plus, the faces of the advocacy were other people. I'm not exactly the prettiest one to put up on face. um, Completely agree. Advocacy is also about establishing reasonable, achievable asks, and that's what Faces have been doing consistently. So thank you to Mary, who our chair of Quebecois Affairs. She is crucial in all of our translation efforts and in delivering Quebec. Essentially, nothing can really happen in Canada without the buy-in from Quebec, and because I did 12 years of core French and cannot speak French. I have needed a lot of help, and Mary has helped deliver. So, Brian, yesterday there was a thread where we said, hey, we'll be fighting for um, those in vaccine poor nations. If the extended family exemption continues on, that's our motivation. If it helps you, great. If it doesn't help you, we're still focusing on the vaccine poor nations. And so there were some questionable comments, in particular, whether or not I was a legitimate person. And Brian was very kind. He looked up my license online, helped show people that I am credentialed, help explain that, yes, I'm a stand up comedian, and what does it matter? Um, so thank you, Brian, very much. I actually sent you a message. You can check your messaging for that. Thank you, Aaron, for everything that you do. Someone asked from the group yesterday, do we know why border measures don't accept partial immunization and COVID recovery? So, COVID recovery is actually part of opting out of testing. So, if you are COVID recovered within 90 days or something, and you have proof of that recovery, you actually are able to come to Canada without a 72-hour PCR. If the question is why doesn't partial immunization count? It's because one dose or partial immunization is not as strong as full dose, and we want to make sure that people have the best immunization possible before coming into Canada. That's the basic idea. Testing and quarantine has been a safe way of reuniting, and regardless of vax status, a vax person is possible. Why is that vax person more safe than unvax person? So, very important question. The question is, why does vaccination uh, change the need for testing and quarantine? So, the current family exemptions, where you're an unvaccinated person coming to Canada, you have to quarantine for 14 days. That is certainly a reasonable alternative. It is not as uh, easy to enforce. So, because of that, I suspect they haven't expanded that to other groups. But for the family exemptions, that's where it exists. Testing and quarantine is a very valuable tool, as is vaccination. So, vaccination, even from areas of high immunization rates and low immunization rates is helpful not only protecting yourself from the long-term harms, but uh, because it protects yourself, uh, it doesn't result in you maybe needing an ICU visit. And these are major concerns. There is discussion on whether or not being fully vaccinated changes the transmissibility of it. But what we can say is if someone is fully vaccinated and they are transmissible, at least the person who's vaccinated is still not going to be getting worse. From my understanding, as a person of the public and not a public health physician, transmissibility uh, is lower amongst those who have been fully vaccinated. And that is because these people are not actually getting the virus and the symptoms of the virus. I also want to take this moment to talk about airlines. The reason why flying in to Canada uh, as an unvaccinated person is a challenge is because you're putting unvaccinated people and fully vaccinated people on the same plane. And I could not figure out a science backed way to navigate that space. My suspicion, and this is based as a member of the public who has been reading topics, is that once we've hit herd immunity, there may be a different discussion. But at the moment, because we're not at herd immunity for a number of places, that we aren't at the point where we have unvaccinated people on the same plane as vaccinated people. So that's the basic idea. Incredibly frustrating that yesterday, not a single time did I discuss the efficacy or safety of vaccines, yet comment I made in the group was removed and I was permanently banned. So I have read what you wrote, and you were quite rude to other people. um, that's as far as I can take it. Um, I said at the start of this that there is a very unnecessary combative nature that has come out. There's a rudeness to it. Um, However, you can see that none of us are kicking you out of this discussion right now. So if you have more questions, please ask them here. But I've seen you post on our public stuff. I believe that much of what you've written has been charged and rude to other people. Uh, that is why you were removed from the group. Okay. Uh, how come at the beginning you were fighting for reunification showing the science that travelers are not to blame for massive spread? How come science has magically changed now? So, very good question. Our rates proportional to the Canadian rates was less than 2% for traveler related domestic transmission of COVID 19. Right now, the they call them sequelae, but the poor outcomes uh, of COVID 19 occur most in those who are not vaccinated. I understand some of you are thinking, well, yeah, but the fully vaccinated can transmit too. That's true, but the reason why fully vaccinated transmission is increasing is because there are just so many more people who are fully vaccinated. Those who are not vaccinated still have worse outcomes and more transmission. So, proportionally, unvaccinated people present a higher risk of COVID transmission and poor outcomes than than vaccinated people. So if in this hypothetical situation we were back last year, everyone is unvaccinated, I would still make the same argument that travelers were a small proportion. But unvaccinated people are now a higher proportion than it was last year. Um, Now, one could say, well, we were still bigger. Well, you may not remember, but Faces of Advocacy didn't become bigger until the NHL was allowed in before families were. At that point, we had every reason to say, what's going on? Um, so, if in this case, unvaccinated hockey players are allowed into Canada before unvaccinated family members, and proportionally, unvaccinated family members are less, or sorry, unvaccinated travelers into Canada are less transmissible and less poor outcomes than unvaccinated people within Canada, then I would make the same argument again that it's not an immigration issue. But these are the nuances and the specifics that are very important to look at. But please ask these questions because I honestly believe having this kind of dialogue can be helpful. What is the determination of herd immunity if there are always going to be variants? Very good question. So I'm going to answer this at the level of someone with a master's of public health. I am not going to answer this as a family physician or a resident in public health and preventive medicine. Herd immunity is based on a calculation that shows how much a disease will spread amongst the community if a certain number is immunized. So you might have been reading in the news something like reproductive numbers, where if the reproductive number is more than one, um, a disease will spread more in that community and will continue to grow. If a reproductive number is less than one, it'll continue to go down. Okay. So your question is, if this disease will always mutate, when are we ever going to achieve herd immunity? And I understand your fear. So with Omicron, for example, uh, there have been a plethora of changes to the travel restrictions, but with Delta, there was not. With Omicron, it's because of the high level of transmissibility. But if we get to this stage where it's transmissible but not overwhelming our ICUs or not causing adverse harms, these things factor in to whether or not there'll be an overburdening of the system and there might be more leeway. It's possible that COVID, the coronavirus, will become much like our flu virus, where every year a number of people get it, and then we'll be at a manageable level. Um, or it could simply go away in the sense that the majority of people are immune to it, and even if it spreads a little bit, it won't be to a damaging extent. Not every variant will change the transmissibility and the poor outcomes. We call it virulence um, uh, and pathogenicity. These things may not necessarily change with each variant. The common flu has a lot of variants, influenza. That's why every year we only immunize for three, the most common ones. Um, it's a big picture when it comes to herd immunity, but the mutations doesn't mean that it'll delay entirely. The best way to address herd immunity is to get immunized, and that will help. So unvaccinated Canadians and PRs can still board an aircraft to Canada. Yeah, that's correct. They're not. That's because Canadians can't actually control the flight coming in. Um, but the government of Canada has said there should be no one unvaccinated boarding a plane. So, I mean, I can't speak for the government of Canada, but their policy is you should be fully vaccinated if you're on a plane. They cannot control a plane coming in from another place. They can only control those within the country. So, if your question is, well, if some planes have partially vaccinated people or non-vaccinated people and fully vaccinated, why can't all planes? The answer is a risk assessment from the government of Canada's perspective, which is of the planes that they can control, we want fully vaccinated people on it. If there was a way that I could figure it out, I would happily do so. But I cannot figure out a way because of the transmissibility of COVID on a plane to do so safely, or at least comparably safe to a plane full of vaccinated travelers. So I'm going to look up this word, VAERS. Is that emergency response system? Something emergency response system? I'm going to have to quickly look that up. I'll get back to that question. Hopefully, there's more updates on flying into the specific Canadian airports and catching connecting flights with required arrival testing going on. So, Brian, your question is what happens if you are ultimately trying to get to Regina? You fly into Toronto. Can you board to Regina? We Before the Omicron new order in council, the answer was yes, you can transit. I'm only speaking now from my gut, but I can't imagine they changed that. Uh, but please message me to remind me to ask IRCC about that because that was something we addressed in the previous travel restrictions and hopefully has not changed. So before Omicron, you could fly into Toronto, do your test, and then fly to Regina without needing to stay in Toronto until your test comes back because that could be days if Switch Health does the same thing as last time. Um, okay, let me look up what this word is. Oh, vaccine adverse event reporting system. Okay, so gosh, so now I have to talk about this. So I will now talk about this at the level of a public health and preventive medicine resident and a family physician, but I'm not speaking to you as a family physician or as a resident. So I'm not giving you any medical advice. So the vaccine adverse event reporting system is if you have a vaccine on a Monday, any sort of adverse reaction, arm pain, headaches, vomiting, nausea, diarrhea, any sort of thing that you have within a particular time frame is to be reported. Now, that doesn't mean every single symptom you have is related to the vaccine. What it means, though, is that we have a safe system that shows how safe we are, that if you have a pre-existing condition, you get a vaccine, and that pre-existing condition, nosebleeds. Let's say you picked your nose and you got nosebleeds. That nosebleed can still be reported under VAERS because anything that occurs within the time frame of the vaccine is reported. Now, at that point, someone with training similar to mine will evaluate and look at this. Okay, they'll say, okay, these are common responses to the arm pain, the headache. These are common adverse reactions to the vaccine. And then they'll also look at, oh, this guy's a nosebleed. Let's follow up. Let's call the family doctor. Let's call the patient. The patient will say, yeah, I got my vaccine, then I picked my nose and I started to bleed. And then they'll write, okay, it's not related to the vaccine. But that's how we're tracking adverse reactions. And that's how, to me, and I hope to a lot of Canadians, we see that there's a lot of faith in how we're doing the vaccine rollout. So, if the spread didn't happen on airplanes previously with nobody vaccinated, why has it changed as of January 15th? So, that's a reasonable question. So, I have to go look now, actually, at directly your question, whether or not there's actually been spread on the airplane. So, that's going to be very valid. Now, the question will follow up, though. Will it have spread in the airport, in the waiting room, in the shared toilets? So those are all very reasonable questions to ask, and I need to go find out more information. So good question. Um, if we're talking about, though, transmissibility and poor outcomes, it doesn't mean that you want to even increase that risk of someone who is known to be higher in transmissibility and poor outcomes in the same location as those who are um, vaccinated. So to put it another way, let's imagine that uh, airplane systems of cleaning are so perfect and that the ventilation is so perfect that in perfect conditions, someone who is unvaccinated could not reasonably spread COVID to someone who is fully vaccinated. But all it will take is for the airflow system to not maybe work the way it should, or for the cleaning to be not perfect. And at that point, you put a higher risk. Now, of course, the question is the risk benefit worth it? We're saying that the risk benefit of having fully, sorry, not, the government of Canada is saying that because the risk benefit uh, of being vaccinated is such that being vaccinated is a safer way to go about it than risking the HVAC system not working or the cleaning not working, that vaccines are important there. Um, but these are reasonable questions, and I need to go look about airplane transmissibility. Okay, owe me a soda. Okay. Thank you for taking the time to discuss differences in difficult topics. I would like to know what your thoughts are on the most recent Lancet article. If you can put it into the chat, maybe AJ can open it because I need to read it. I don't know it. Um, Okay, people are in different areas of Ontario. Um, okay, uh, Pamela, thank you for messaging. I know in the discussions you yourself are worried. Um, I am not your physician. No one on the Facebook page is probably your physician. Speak to a trusted physician on the safety of the vaccine. Speak to anyone you trust as much as you can about what worries you. And I really think there's a lot that could be discussed in a productive way. Okay, so I guess we're going to stop soon, but stigmatizing the unvaccinated is not justification, Gunnar Kampf. Okay. Um, okay, well, I guess I can read a quick summary here. Um, so in medicine, we do something called journal club. A journal club is when you take a look at um, an article and you discuss it with other people. So I guess we're doing this. Stigmatizing the unvaccinated is not justified. Okay. So this is on November the 20th. It's published in the volume 398. Okay, so I'm just going to quick read here. Um, oh, this is a letter. This is not a review article. This is a letter. So uh, I want to preface this as that it's published in a reputable journal, and it is a letter, which means it is one person's opinion. Whoever this Gunter Kampf is, and I don't know who that is. Okay, so uh, this person is talking about how the view is too simple about the vaccinated, uh, the unvaccinated being, sorry. Oh, by saying that those who are vaccinated are not relevant to the epidemiology of COVID-19. So the first paragraph is saying that it is wrong to assume that fully vaccinated people are not part of the epidemiology or not part of the spread. And that is true. I don't know of anyone, though, personally or professionally, who have said that vaccinated people cannot spread the virus. Okay, so the next paragraph talks about how vaccinated people are able to spread the virus, which I have not been debating. Um, okay, so here's where critical reading is important. In the USA, a total of 10,000 COVID-19 cases were reported in vaccinated people, of which a quarter were asymptomatic. Um, 7% were hospitalized, and 1.6 died. Okay, so in Germany, um, 22% of people who were fully vaccinated attended a nightclub. People who are vaccinated have a low risk of severe disease, but are still a relevant part of the pandemic. So it is therefore wrong and dangerous to speak of the pandemic of the unvaccinated, and that's correct. It's. I mean, I don't know if you guys were able to watch my video on Tuesday, and I am saying this directly to every single person here. You should not be labeling every person who is not vaccinated with the same brush. I'm flat out saying some people are hesitant and unable to get vaccinated for various reasons. And pointing at them and saying you are the cause of the pandemic is disingenuous. It's wrong. It's not correct. I do feel that I have not said, though, vaccinated people are unable to spread. I am saying the transmission is lower and the outcomes are better. So, uh, for everyone here, do not paint every person who's unvaccinated as a anti-vaxxer protesting in front of hospitals saying that the doctors are being paid off with Illuminati money. Okay, that is not true. That's why we say don't debate the science, because the science is true. And it's important to read things. Vaccinated people can spread. That's not the biggest take-home point. The okay, we'll read more. Sorry. Anyway, let's read what's next. Um, in short, the biggest difference is because vaccines were not available a year ago. Okay, that's what we wrote. Um, whether vaccines were available or not is irrelevant. It doesn't change the amount of spread that occurs on airplanes or travelers, which is next to one, none, the entire pandemic. So vaccination allows a safer way for the person and a safer path to lower transmission. You're saying specifically, if it's impossible to spread on an airplane, why does it matter? And I'm saying maybe in ideal conditions, but that's not to say that's not possible. And you're saying, well, it never happened, so why should it? Now, first off, I have to go read whether or not it happened. Secondly, we're not looking at the fact that what happens when you come out into the hallway, into the airport, onto the bus, or onto whatever it is. So let's assume it's a perfect scenario, which I don't know if it's true, but a perfect scenario on the plane. You're missing the waiting room, you're missing the hallway, you're missing the hallway out, you're missing the waiting room out. There's still a lot of vectors. And even with all that considered, transmissibility and poor outcomes are still in effect. Um, I should go learn more about the transmission on an airplane. But this is an assumption that there's zero transmission possible in any of the facets related to an airplane. To lower the risk, vaccination is very important. I am not judging people's decisions. Okay. Um, Thank you for tonight's discussion. I'm sure moving forward, Vax Hesitant will determine if they want to participate in the one click. And Vax Hesitant, you have a place to talk. You really do have a place to talk. I understand their concerns. As long as you're not saying vaccines give you 5G, I think we're okay. All right. Um, and now we're talking about why can American families not cross via land after January 15th? That's a good question. You know, they've taken the policy. Right now, all I can say is we want the extended family exemptions to still exist. We're going to push for it because those in vaccine poor nations don't have access to the vaccine. You have a very valid point. Why is that on the why is that affecting drivers? Right now, Faces of Advocacy can only do some things. We can only barely do some things. Join us on Thursdays, Advocacy Thursdays. Join us what we're doing. The person messaging, if you are passionate, the Faces of Advocacy are not David Poon and doing stuff. It's a bunch of us as a federation. So you're very free to message your MPs. I know there are other groups. This is what we can do, and this is what we're trying to do. We were successful at the exemptions, and we're going to fight to preserve what we can and help families. Thanks a lot, guys. Message anytime. Have a wonderful day.